Hello, welcome to part 3 of the Botox for Bunions video series. If you haven't already, watch part 1, which talks about the evidence for using Botox for bunions. In part 2, you see the procedure being done. And in this part, we are going to find out how our patient is doing 6 months post-intervention. So without further ado, let's have a look at the x-rays. Before the injection, her Hallux Valgus angle was 12 degrees. It is now reduced to 8 degrees. The intermetatarsal angle was 20 degrees, it is now reduced to 18 degrees. This is after one injection. Also, we gave the patient a Oxford-Manchester foot questionnaire. Now she completed the questionnaire before the intervention and then every month after the intervention for 6 months. We took the average scores and we collated some tables. The first table you can see is the pain score, which has significantly reduced. Her walking and standing has also improved, and her social interaction has also improved. From speaking to the patient is currently in no pain at all from the foot that had the intervention, the injection. She now wants the other foot done. Let me answer some of the questions that people may have. Before I do that, let me apologize for using the term twerking when I was doing the injection, when I should have said pulsating. Goes to show I'm listening to far too much hip-hop music, guilty as charged. So the first question people may have is, where did you get the methodology from to use a lateral muscular stimulated guided injection and the location of the injection? Well, we got the methodology from the 2 of the RCTs that have been done regarding the use of Botox for bunions and from several case studies. Interestingly enough, there is currently a study going on in the USA, which is a multi-dosed, double-blinded, randomized controlled trial with placebo for the efficacy and treatment of using Diasport, which is a type of Botox for bunions. They've just finished completing all the data collection in May of this year, so the study should come out next year. They had 186 participants in 26 different locations. And this is the first time that a RCT has been done with a multiple dose of Botox for the treatment of bunions. And I'm really looking forward to seeing the results. The preliminary results that I have heard about and I have spoken to people about is very promising. So that's where we got the methodology. Secondly, the adjuncts. Now, what is the evidence for the adjuncts? Let me explain what the adjuncts are. The adjuncts are when we gave the patient orthotics to use, a bunion night splint, a toe spreader. We also instructed the patient how to do mobilization on the toe and how to strengthen certain muscles in their feet and legs. Now let me be very honest and very candid. There isn't a great deal of evidence regarding these adjuncts. That being said, the way I think about evidence-based medicine is that we have the best possible evidence, then we have patient values and preferences, and then we have clinical expertise. And I think somewhere in the middle sits evidence-based medicine. We also have a study by Tang et al. In 2016, which said that an insole with a toe spreader and a Botox injection has promising results. Let me also talk about this table here, which has four studies. Now I understand it is only 4 studies, but let's talk about it a little bit more. The first study has just insole, and it was looking to see if they could correct the bunion angle, and it didn't reach any significant improvement. The second study in this table is also just using insole as an intervention, and it was looking to reduce pain. It also was not able to have significant improvement. The third study in this table was looking at using an insole with a toe spreader, and it was looking at reducing pain, and it did have significant improvement. Also, the fourth study was the use of Botox for bunions, and it was looking at the reduction of pain, which it also had significant improvement. Now, what do podiatrists currently do conservatively for the treatment of bunions? Well, I think that's an interesting question. We have a study that was done in Australia, I think it was 2016, and they interviewed 1,900 podiatrists. And they asked them, what do you do? And I'll put up a table here to show you. Primarily, they would giving footwear advice. They were offering orthotics, custom orthotics, or like semi-custom orthotics and bunion pads, etc. I think maybe a Botox injection can sit within this paradigm. Am I opposed to surgery for bunions? Absolutely not. I think surgery is a valid option for the treatment of bunions. In fact, 4 of my biggest heroes within podiatry are surgeons, which I may talk about at a later date. However, I am of the opinion that surgery should be a final treatment option rather than the first treatment option. Once you cut bone, you're not putting it back. Once you put a screw into your foot, you're not taking it out. And I'm not the only one that feels this way. There has been several papers that have said that all conservative measures should be exhausted before surgery is considered as an option. And this is a quote by Hallux Valgus, I think it's 2014. The next question is this a temporary measure? You could possibly do with a top-up. Now, I may recommend for patients to have multiple injections over the course of 12 months. However, there has been a study done that has found significant improvement in angle and pain to a bunion after one singular injection, and that was 2008, and I think it was Radovich et al. And it was 15 months post-injection. The next question people may have is muscular imbalance a significant factor for the production of bunions? For the progression of bunions. Now, the etiology, the causes of bunions is multifactorial. There is many different reasons why you can get bunions. Everything from genetics to footwear to trauma to the length of the first metatarsal to the shape of the first metatarsal head, and hypermobility, flat feet, pes planus, possibly. There are many other causes. There are many reasons why you can get bunions. Muscular imbalance has been cited as one of the major causes, and I'll put up a couple of references here. Are there any side effects for the use of Botox for bunions? Yes, there are, and there are some patients that are not good candidates for the use of Botox, and this is something that we go through with you on the initial consultation. Hope you found this video series interesting. We will be making further videos in the future, and thank you for watching.